People with autism have trauma. That's obvious. Even recent articles and research have been sort of saying, yes, not only do autistic people have trauma, they are very much more likely to be at risk for experiencing trauma. And in recent articles, we've heard about this idea that something that could be considered a mild stressor in a non-autistic population could actually be traumatic for an autistic person. I'm going to share today some newer research presented on autism and trauma, and I will link everything I use in terms of resources in the notes below. The goal at the end of this video is for you to understand some other areas of trauma and to emerge and understand why it's so important to look at your own life and anyone you love who may be on the spectrum and how trauma and childhood adversity might impact their life. I'm a licensed clinical psychologist, and so I welcome you here. I've been gone for a few weeks, taking a break, but it is so good to be back. So what I want to share is a presentation that Dr. Kern shared, and I will summarize in large part what I think is really a condensed way to help you understand what we're talking about in terms of these other areas of trauma, specifically 3 other areas of trauma that may really deserve more focus. But I would encourage you, if you have the time, to go and listen to the full presentation. So first of all, let's just talk about childhood adversity, what that is, and trauma, because these are the working concepts that are important in doing deep dives in research. And there's been really a very small amount of research done in trying to understand trauma in the autistic population. So these tools that are shared in these research articles and these presentations, a lot of this research is being done to begin to create, and they are creating tools to identify different sources of trauma, how to assess, and how to help those who might be suffering. So the idea of childhood adversity first came from the childhood adverse experiences studies, and these were looking at how do things that happen to us in childhood affect our adult lives. Now, the studies were initially meant to be done on understanding obesity in a certain population in San Diego, but it turned out that it became much more than that, and that through this research, it was discovered that not only is something like obesity potentially impacted or related to or correlated to perhaps childhood trauma, but many things when it comes to our health, that we can have increased risk for things like cancer, diabetes, autoimmune disease, traumatic brain injury, mental health issues, of course, maternal mortality rates, just teen pregnancy, all kinds of things can be related to what happens to us in childhood. And for example, the childhood studies that we looked at that helped us create tools to help us assess these things, I would say vastly under-identify and under-represent the vast array of traumas we can experience. So an adverse event can be anything from neglect to emotional, physical wounding. It can be parental divorce, IPV in the home, anything dangerous, accidents, injuries, illness, parents who are suffering in all kinds of ways, financial dynamics and limited resource opportunities, home, challenges with people, school challenges, all kinds of things. And so when we're talking about autistic people, we're going to just say that we've already known, for example, that there's an increased risk for many things, for their caregivers, for the children. And the studies I'm referencing in this particular one were done on a higher needs autistic population. That's important to keep in mind, many of which also had caregivers. So there were some limitations if they were nonverbal. So I want you to think about this in the spectrum of if these are what people who are higher needs experiencing, it doesn't change the fact that if you are a lower needs autistic person, these traumas might affect you or wherever you are. So we're trying to understand there's so much within this pool. It's hard to generalize, but I do think it's worth talking about. So the research is showing that there's not as many higher levels of PTSD, for example, in children who are autistic. And it's like, why is that? Well, one of the possibilities may be that what we use to diagnose trauma, the criteria required don't necessarily hit at the targets for the vast array of autistic traumas, for example. And so it turns out that for many autistic people who have had a lot of trauma, they actually may not hit the criteria for something like PTSD, post-traumatic stress disorder, or even complex PTSD, which is not in our DSM, but part of the ICD criteria in terms of diagnostic opportunities, but that many autistic people actually play out their trauma in symptoms of anxiety and depression. And I'm going to come back and talk more about anxiety and autism in some future videos not too far from now, because I have found this tends to be, at least in the high masking population, which is those I am working with, tends to be extremely common. So that's one thing. It might not manifest because of the criteria. So what are the criteria? For example, in the DSM, the criteria really look at things like, level of exposure to threatened life, death, violence, or witnessing it. And the problem with that is that it vastly minimizes and ignores the other things that we often call big T and little t traumas. So for example, the DSM diagnostic criteria is looking for more like single event, big traumas. Now, it also could include bullying and things like that, but the bottom line is that it's big T. It's more looking for big T. Turns out that many of us have a lot more, most likely, or at least a combination of also little t traumas. And so as opposed to a more single event or higher level, theoretically, of life or death trauma event, and I'll post here the DSM criteria generally, that something like the SAMHSA criteria, which is a more broader definition, would describe trauma as something like an event or series of events or set of circumstances which are experienced as physically or emotionally harmful or life-threatening. So we really want to say with autistic people that using a broader definition looks like might be really important to understand the level of traumas. And I would say this is true for everyone, because we can't necessarily say that what I experience as trauma, we watched the same event, we were both victims, is going to play out in the same symptoms. And so the idea is that something like a trauma is an experience that happens, how you appraise the experience, and how that affects you. What are the effects? And so I really like this idea of understanding that it is often about how each of us, how do I appraise it? How do I assess what happened? How does it impact me? And how do I express those things that bother me, that are traumatic, that are difficult, that are truly clinically important or otherwise? How does that play out? And of course, it's going to look different for all of us. So they took some studies. They did a qualitative study, and don't forget, this was a very also small qualitative study. That a qualitative study kind of gives ideas. We can't necessarily generalize it to the population, but it creates questions and more thoughtfulness around what else we want to know in a research project, for example. And I love this analogy. Dr. Kern talks about the idea that, for example, if you observe somewhere in nature a black swan, all you can say is, oh, there can be a black swan, but we don't know anything about how many black swans, how black swans are different. So we're thinking of this in that same way. We're looking at this population and this study to say, these are some things that might be more worthy of understanding. So let's get into it. What did they understand about trauma? What came up? And there are 3 specific other areas that I want to talk about. So first of all, there were a significant number of common adversities that autistic people in this study struggled with. They were things like death of a loved one, emotional wounding, physical wounding, and bullying. And I think all of us would say, yeah, those tend to hit the bell for what we think of as traumatic experiences. But there were 3 in the other category that I want to talk about in today's video. And this is where I think that, keeping in mind this was a smaller study and done on higher needs autistic people, but that I do believe this can considered possibly be, right, we don't know, but it makes sense that for all of us we could apply it in different ways depending upon where we are on the spectrum. Now, it's going to vary, right, but that's important. The number one thing that came up in other is something I have been talking about to patients for years, which is that when you have trauma, to me, one of the worst things I feel when I get to a state of hopelessness and fear is when I feel, and this was number one, trapped, feeling trapped. Now, I've always talked about it in terms of trauma and childhood trauma and PTSD trauma, not trapped like I was trapped in a dangerous situation, but trapped in my life, trapped in a marriage, trapped in a job, trapped in a physical health issue, in situations where we feel like we can't get out of it. And that is the number one of these three dynamics. People identified in this study that feeling trapped due to, now this is going to be more autism specific for this population, due to emotional or physical restraints in therapeutic environments, talking about therapies that have been harmful, or schools. We're not talking about therapies, and there's a big debate around ABA and keeping kids safe. This isn't about that. There's a lot of debate within the community about that, and I'm going to talk more about that in Hannah Belcher's research when I make a video soon on autism and the female phenotype. But the bottom line is that regardless of why it's happening, and there's a lot of important discussions about how or why, but being restrained in a therapeutic environment was traumatic. The loss of autonomy and not having a sense of agency and this indecision making. And so this is kind of that whole idea that making decisions and having autonomy is an important part of us standing in our own bodies and lives, and that there can be this loss of opportunity and self-determination. So number one was feeling trapped as a significant potential source of trauma for autistic people. Number two, social exclusion, resulting from bullying, social isolation, alienation, stigma, discrimination, and betrayal by individuals in their lives. Now, this makes sense to me. I'm going to just speak from my experience that this balance between people being too much and wanting connection, but also feeling like I don't know how to be in that, being judged and not like understand why. I've shared in older videos about, coworkers saying like, she's such a bitch, and me being like, what? Like, I just never thinking that I would present that way. I think it's for many reasons where this can come out. Feeling like we're different, and I am obviously very high masking. So it also depends upon how these symptoms, or not symptoms, but these traits might play out. But the idea that I think there's often, at least for me, I'm witnessing, and this is my very small pool of people who were reaching out to me in the last year who are high masking autistics, this push-pull between like wanting connection and being overwhelmed by connection, from a sensory perspective, from a cognitive perspective, all of those social communication and nervous system dynamics where we need to be alone to regulate, but people are often the trigger. And when you add that into trauma, you can see how all of this overlaps. So this intersection between autism and trauma. And the last one is a category called traumatic incongruities. And these are experiences that stem from inhospitable environments, including sensory experiences, overwhelming transitions and changes, and the chronic stress involved when you need to predict and decipher a social situation. So that is, to me, is just massive. This idea that just the like, I want to be here, but my sensory issues are raging. I'm overstimulated. I'm trying to understand and decipher this social situation. Like the inherent stress and particularly potentially trauma of being in these incongruous environments and how that in and of itself can create trauma. And so I think it's really important to look at how all of this might impact you and to think about how something like feeling trapped, feeling socially excluded, being in these incongruous environments can be traumatic. And of course, that even included in this study things like haircuts, social interactions, doctor's appointments, life events, life transitions. So it's going to depend, but I think it's important to say that there are so many things that have shaped not only our trauma, but also why we might mask because it was traumatic and trying to avoid these things, but often also carrying a lot of trauma. Now, in the second part of this presentation, Dr. Kearns talks about how they are working on developing and identifying ways to create indicators of trauma. How do we identify trauma and indicate it? What are the things that are behaviors that are indicative of trauma that might not be found in the autistic community that are not in the DSM, for example? So traumatic, not in the DSM, but traumatic for autistic people. And in service of all of this was to understand and the continuation of trying to build an assessment tool called the CASQ, the Childhood Adversity and Social Stress Questionnaire that they're working on, which is an autism-tailored measure of adversity and traumatic reactions for children and young adults with autism. And they identified things like regression of skills could be a sign of trauma, of adaptive skills, self-wounding or self-harm behavior. I'll list more of these down below. Excessive reassurance seeking and reduced communicative language. And so I think something like excessive reassurance seeking is something I've talked about, what I believe is the crossover in many regards of something like hypervigilance and trauma and autism. So like, reading people but needing to assure, are we good? Are we okay? Are you okay? Are you mad? It didn't go into that, but for me that came up. Anyway, those are, I think, 3 really important areas to look at and consider as you try to assess, well, how have I been impacted, whether or not you might be autistic or you love someone who is. And I just think it's important to keep sharing because we are so, like I'm saying, far from where we need to be in understanding trauma and really understanding other presentations of autism that don't necessarily fit into the DSM. So that is it for today's video. Thank you so much for being here. Please stay safe and well, and I'll see you soon. Take care.